When medical treatments are no longer working, it may be time to consider hospice. Hospice is a program of specialized care for people with any terminal illness. The decision to use hospice can be difficult, but can be of great relief for all concerned in the last 6 months of life.
It took a number of weeks of a lot of patience and a lot of understanding on both parts until finally I began to smile again. And it's all due to hospice. Then I went to my doctor for a regular appointment, and he said that he would prefer if I started taking hospice, and I was violently opposed, real arrogant, and I fought him tooth and nail because it was always my imagination that hospice was a place where they sent you to die. But they finally convinced me, and boy am I glad today that they did convince me about hospice, because I can't say enough about the things that they've done for me. Hospice, I think, is the gem of the business. I hate to say business, it's a service, but it's a care, it's a living care. They feel what you're feeling, and they nurture that. And I think that's the way we get out of some of our doldrums. Hospice will go to the left or right to serve your needs. And they will be here whenever you need them. You want to know something? I haven't seen a bill since I've been on hospice. So somebody's picking those up someplace along the line. And I just as soon not look at them. I never thought in this world, in this day and age, that there were people around, such as all the people from hospice. They have been outstanding.
Hospice is for children and adult patients.
With the illness, we were obviously always hoping that Daniel was going to get better. The chemotherapy, the radiation, as it got to a point where it was obvious that things weren't going to work, hospice was mentioned a few times at the hospital. When you're placed in a situation where a family member, a loved one needs that kind of care, it's overwhelming. It really, really is overwhelming to try and take that on yourself. And you know, it's not saying that you can't do it, but it's so much more comfortable and it's so much easier to know that you're not alone. And that's where hospice came in. And they didn't just walk in, case number 101, and do what they had to do, administer medicine or give us advice or tell us what we needed to do and walk out the door. They spent time, and it was quality time, because they weren't just taking care of a patient. They were taking care of a human being, and they were taking care of a part of our family and what became a part of their family. Each individual patient has to be like the only patient, because that's what that family needs to feel. They need to feel that you're there for them, and that's what we needed to feel. It's nice to have somebody there, even, for the medical terms, who knows what. I don't know everything. I mean, I learned a lot, but I don't know everything. And had something gone wrong and I didn't have someone to fall back on with that knowledge and that education, it makes it a lot more difficult. It puts more stress on you. And at that time, I said, you're so emotionally charged, you really don't need any more of the stresses in your life.
Hospice cares for people with heart and lung disease, dementia, cancer, liver disease, ALS, AIDS, stroke, and other terminal illnesses.
I think what really made me think of it is when she got real sick and I wanted her to have pain medication, and I wanted to be able to call somebody at 3 in the morning if I needed to. Even though I knew stuff, I had worked in a nursing home, I went to nursing school, I wanted to have somebody to back me up if I didn't know something, or, you know, to tell me what to do. At first I felt stupid because I had went to school for it, and I thought, you know, I should know this stuff, but when you're drained and you're tired and it's 3 in the morning and you're worried and you're scared, you just, the nurse made it so clear to me that it didn't matter what time or how many times that I had to call, just call with your question, and you get called back like 5 minutes later. And I would call and I'd say, you know, what should I do? And they were very comforting, and they'd say, you know, if there's any problems with that, then call us back. I think a lot of families are like this. We seem open and everything, and then, you know, when somebody wants to come into your home, and at times when you might be fighting, or times when the house is not always clean, you don't want strangers in there. But after a while, I was just, you know, I was more concerned about her, so I was just like, forget it. You know, if they have to come when the house isn't clean, or when there's an argument, and there's always argument at my house with a big family, then I didn't care. And when they did come and that stuff was happening, they were very understanding, and they weren't like, never passed judgment. They understood, you know, this is how real families, real life, how it goes. And, you know, they never got into that. They were very focused on my grandmother. And that was really good, to talk to somebody that wasn't in the family, that you didn't have to worry about putting stress on them. You know, this was a person who is trained and who's supposed to take all this in, so you don't feel guilty about laying all your stress on them. All that kind of stuff that they did really helped her spirit more than anything. I mean, she didn't really understand the physical benefits and everything like that they were doing for her, but her spirit really, that was the biggest thing they did for her. Just the time of people talking and laughing with her. I know that she really enjoyed that. And that's what made me so happy, so grateful for them, is that they could do that for her.
Hospice provides pain medications, medical supplies, medical equipment, and oxygen if needed.
I retired early to be with her because she needed someone with her all the time. So by comparing what it was then to what it was after hospice came, of course, when I was there alone, it was, everything depended on me. And I was always concerned about leaving her alone in the house and going shopping and keeping appointments and things like this. But after hospice came in, there was always somebody available to come in to help me, or just to be there and let me shop and keep appointments. And everyone that came ended up to be a good friend to us. We really appreciated that part. The county nurses came in for a while, but when it became kind of obvious that she needed more help than they were able to give, we had to make a decision about whether to go into a hospital or a nursing home, or what our alternatives were. And it was suggested to us that, you know, maybe we might want to consider hospice. And at the time, I knew very little about them. And I guess we had some thoughts about them that, you know, we were uncertain about whether we wanted to have hospice. And some of the things that concerned my wife, at least, was we felt going into hospice, we would sort of cut our doctor out of the picture, which isn't true. He still made all the medical decisions and so on. And she was a very private person. She didn't want a lot of strangers coming in. But our home health aide was an extraordinary person. And by the second day, she wasn't a stranger anymore. She was family, practically. The nurses came in, and we were just delighted. They were very professional, and they arranged for all the medical equipment that we needed. And I don't even know where it came from. Some of the things that they provided, I wouldn't have known how to even go about getting them. But they came in and took care of everything and helped keep her clean and keep her refreshed and keep her comfortable. Things like this, you know. I think a lot of people sort of miss out because they don't get involved with hospice early on, and they should. I just think the sooner that it happens, the better.
Hospice provides compassion and care when it's needed most.
You know, if it's a situation and you're contemplating, do I need hospice, do I not, have an open mind, because you'd be very surprised at what's going to come through there, and very delighted. It's really, it's worthwhile.
For anyone who's considering it, just let them come and interview you and talk to you and let them explain what they can do. You can always say no, but I don't know why anyone would.
Anyone can request hospice services. Call for more information.